Welcome to MEDTEACH. Today we are going to discuss about the pathology of neoplasia. First, let us see some general concepts. What is neoplasia? Neoplasia is a new, uncontrolled and abnormal growth of cells that is not under physiological control. We have another term called tumor. Tumor generally means a swelling or a mass. It can be benign or malignant. And the study of all these tumors is known as oncology. Now, let us see the characteristics of neoplasms. As we have seen, a tumor can be benign or malignant. A benign tumor is usually well differentiated, which is going to have a slow growth, and it is generally non-invasive and non-metastatic. That means the capacity to move from one place to another place is not there for benign tumors. It is generally non-invasive, well-differentiated local growth. Okay? But when it comes to malignant tumors, these tumors will have a rapid growth, fast-growing tumors. Okay? They are poorly differentiated as well. That means what? We will not be able to find out the borderline of these tumors. Okay? And it is invasive and it has a metastatic potential. So, it can invade the nearby blood vessels, it can invade the nearby structures, and it can also metastasis from one place to another. That is, it can travel from one site of origin to a distant site also. So, this is the characteristic of malignant neoplasm. Normally, when we discuss about benign tumors, we will use the suffix "oma." For example, adenoma, lipoma, like that. Regarding malignant tumors, when we discuss, it can be a carcinoma, sarcoma. A carcinoma usually means epithelial origin tumors, whereas a sarcoma means it is usually from a mesenchymal origin. However, there are some exceptions as well. For example, lymphoma, melanoma, seminoma, these are all malignant tumors, but with the suffix oma. So, if we see the nomenclature of the tumors, again if we discuss, it can be benign or malignant. The benign tumors can be again from the mesenchymal origin or the epithelial origin. The mesenchymal origin tumors will include the types like fibroma, lipoma, chondroma and osteoma. And epithelial benign tumors are classified on the basis of cell of origin, microscopic pattern and macroscopic pattern. For example, adenoma, papilloma, a polyp or a cystadenoma. Okay. Now coming to the malignant tumors, again this can be of mesenchymal and epithelial origin. As we have already seen, the mesenchymal malignant tumors are having the suffix sarcoma. For example, fibrosarcoma, liposarcoma, chondrosarcoma, osteosarcoma, like that. When it comes to the epithelial malignant tumors, these can be carcinomas like malignant epithelia, squamous cell carcinoma, adenocarcinoma, transitional cell carcinoma, like that. Okay? And it depends upon the tissue of origin also. So, what is the tissue of origin? For example, renal cell that is arising from a renal cell, it is known as renal cell carcinoma. That is arising from a liver cell, it is known as hepatocellular carcinoma. And another thing about the malignant tumors is that it also depends upon the cell of origin. Like for example, blood forming cells, if it is arising. For example, when it arises from the white blood cells, it is known as leukemias. When it is arising from the lymphocytes or their precursors, it is known as lymphomas. Okay. And coming to the neoplasms, some of the neoplasms can also have origin from the primitive embryonic tissues. Okay, so they are often pediatric neoplasms. So such type of malignant tumors are given the suffix blastoma. For example, retinoblastoma, neuroblastoma, hepatoblastoma, medulloblastoma, etc. And in 2% of the cases, cancers are composed of cells of unknown origin as well. Now, what are the hallmarks of a cancer? Hallmarks of a cancer is that it is self-sufficient in growth signals, it is insensitive to anti-growth signals, and there is evasion of apoptosis, that is cell death is not going to be there. Only cell growth is going to be there. And it has a limitless replicative potential, that is the cells are going to divide and go on. Okay, there is no stoppage for this cell division. And there is sustained angiogenesis and tissue invasion and metastasis. What is angiogenesis? That is formation of new blood vessels for the growth of these tumors. Also, it is going to invade the nearby structures, nearby tissues. And metastasis means movement of the tissue from one place to another. Now, carcinogenesis usually involves the process of initiation, promotion and progression. What is initiation? There is an irreversible genetic change. Promotion means clonal expansion of initiated cells are there. And progression means there is acquisition of a malignant phenotype. So, in the initiation, for example, a genetic carcinogen is going to act upon the initiated cell, which is going to have cell proliferation. Okay, so that is promotion. And finally, progression means additional genotoxic and promoting carcinogens will be added upon, so that there will be genomic instability and there is increased cell proliferation as well. So let us see some genetic basis of this. Proto-oncogenes means promote cell growth. For example, RAS and MIC. And there can be tumor suppressor genes as well, which will inhibit the growth, that is TP53 and RB, that is nothing but retinoblastoma gene. And there can be DNA repair genes as well, which will maintain the genomic integrity. So, proto-oncogene, genes that regulate the cell division, that is a proto-oncogene. Okay, so it is going to control the cell division. Okay, this is a basis of normal cell division. But when these proto-oncogenes are converted into oncogenes, what is going to happen is there is uncontrolled cell division that is leading to tumor formation. So that is nothing but a mutated or overexpressed proto-oncogene, which is a oncogene. Okay, and let us also know that in benign tumors or malignant tumors, we also have grading and staging. What is grading of a tumor? It is nothing but the degree of differentiation based upon the histology. Whereas depending upon the extent of the tumor spread, it is also staged based upon the TNM system, which is tumor size, node involvement and metastasis. Right? So what is grade 1, grade 2 and grade 3? Grade 1 means we'll have a glandular or tubular differentiation where more than 75% of the tumor forms glands. And there is nuclear pleomorphism as well. Uniform cells with small nuclei that is similar in size to the normal breast epithelial cells. Okay, so this is a breast cancer grading where in grade 1 almost the cells are normal, similar to the normal cells. And mitotic count also will be less than 7 mitosis per 10 high power field. So this is grade 1. Coming to grade 2, if you see there is 10 to 75% of tumor that forms the glands and the cells will be showing a little changes here. Okay, nuclear pleomorphism is more here. Cells are larger than the normal with open vesicular nuclei. Visible nucleoli is also there and moderate variability in size and shape. There is a change in size and shape of the cells here. And the mitotic count also increases in the grade 2. It becomes between 8 to 15 mitosis per 10 high power field. Coming to grade 3, the tubular or glandular differentiation will be less than 10%. Okay, so will not be able to differentiate between the normal cells and this thing. And there is nuclear pleomorphism. The cells with vesicular nuclei and prominent nucleoli, and there is a marked variation in size and shape of the cells. Okay, so there is more difference between the normal cells as well as the tumor cells. Okay, as you can see in the picture. And here the mitosis count is very high. It becomes more than 16 mitosis per 10 high power field. Okay, yes. TNM staging depends and it varies upon the various types of cancers. Know that TNM means it is tumor size, nodal involvement and metastasis. Now, what is metastasis? As we have seen, metastasis is the travel of the tumor from one side to another side, and it can happen through various routes. It can be a lymphatic route or hematogenous route or a seeding. Lymphatic route is common in carcinomas, hematogenous route is common in sarcomas, and seeding is spread within the body cavities. For example, it is seen in ovarian cancer. Now, there are some syndromes that is going to happen with these cancers, which are nothing but the paraneoplastic syndromes. So, what are these syndromes? These syndromes are nothing but the symptoms that will occur due to specific tumor secreted substances. For example, if ACTH secretion is there from a tumor, then the patient will present to you with Cushing's syndrome. What is Cushing's syndrome? We know the person will be having a moon face, he will be having a hyperglycemia, CNS irritability, thin extremities, and in females there can be amenorrhea, hirsutism, and also in males there will be gynecomastia. And these persons will also have very thin skin, purple striae, and bluises as well as petechiae. And suppose if there is parathyroid hormone related secretion, then the patient can present with symptoms of hyperglycemia. That is nothing but formation of stones, there will be weak bones, there will be painful groans as well as psychiatric moans. Now, what are the important correlations with the tumors we should know? Cachexia is a common symptom in cancer or neoplasm, which is going to happen due to weight loss, mainly due to the factor TNF alpha. Also know that we have specific tumor markers for specific cancers. For example, AFP, which is nothing but alpha fetoprotein, is a tumor marker in hepatocellular carcinoma. The same way, CEA is for colorectal cancer. And also PSA, that is prostate specific antigen, is for prostatic cancer. Remember, hallmarks of cancer is very important for your theory as well as your viva. TNM staging is more prognostic than the grading. Exceptions to OMA rule are frequently asked in exams. Thank you for watching MEDTEACH. Follow us for more videos.